Acute salpingitis refers to a high genital infection affecting one or both fallopian tubes, often accompanied by endometritis, reflecting a global involvement of the female genital tract. This type of infection frequently develops following a sexually transmitted infection located lower in the genital tract. The infection progresses in an ascending manner, meaning it moves from the cervical area toward the tubes. Iatrogenic factors, like some intrauterine procedures, for example, the insertion of some intrauterine devices. The two main pathogens responsible for this infection are Chlamydia trachomatis and Neisseria gonorrhoeae. Sometimes these bacteria can be associated with other pathogens, notably anaerobic germs. This is a medical emergency, both diagnostically and therapeutically. Rapid and appropriate management is important, as the primary goal is to preserve the patient's fertility. Acute salpingitis represents the leading cause of female infertility related to infectious complications. The complications of acute salpingitis, although varied, can rapidly worsen the patient's condition and lead to serious consequences if not managed in time. Let's start with the acute complications. The one first, an isolated pelvic abscess. A pelvic abscess can occur in cases of untreated or poorly managed acute salpingitis. It presents with persistent fever, a general deterioration of health like asthenia or fatigue, as well as an intense and lasting pelvic pain. During a vaginal examination, a laterouterine pelvic mass, often poorly mobile relative to the uterus, may be palpated. To confirm the diagnosis, a pelvic ultrasound typically shows a fluid collection in the pelvic region, and a laparoscopy then becomes indispensable. The pelviperitonitis. This serious complication requiring an emergency surgical intervention. It is accompanied by a severe infectious syndrome that can progress to more complicated forms such as Salpingitis or the accumulation of pus in the fallopian tube or an ovarian abscess. In this case, laparoscopy is the technique of choice. It allows not only assessment of the extent of the peritonitis, but also targeted and effective treatment to drain the infected collections. Thirdly, perihepatitis, or what we called Fitzhugh-Curtis syndrome. This is a specific complication linked to a genital infection with Chlamydia trachomatis or Neisseria gonorrhoeae, whether old or ongoing. This condition is characterized by violin string adhesions stretched between the anterior surface of the liver and the diaphragm. These adhesions can cause pain in the right hypochondrium, sometimes mistaken for liver or biliary pathologies. The diagnosis is confirmed by laparoscopy, which allows direct visualization of the adhesions. Medium and long-term complications severely affect fertility and the quality of life of patients. First, infertility and high risk of ectopic pregnancy. One of the major complications of salpingitis is infertility, often due to adhesions formed around the fallopian tubes or between the tubes and ovaries. This results from residual inflammation, which causes lesions of the tubal mucosa. These lesions can lead to tubal phimosis, meaning a narrowing or partial obstruction of the tubal opening. Ovarian cystic dystrophy, which is an alteration of the ovaries due to the presence of peritubo-ovarian adhesions, further complicating ovulation and fertilization. These anomalies significantly increase the risk of ectopic pregnancy, a serious condition in which the embryo implants outside the uterus, usually in the fallopian tube. Secondly, chronic salpingitis and chronic pelvic pain. Unresolved salpingitis can progress to a chronic form, often resulting in chronic pelvic pain, which can be disabling and impair daily quality of life. 3. Infectious recurrences. Recurrences are frequent, occurring in approximately 20% of cases. Each recurrence episode worsens tubal and peritoneal lesions, further increasing the risks of infertility and complications.